So let us begin with the second topic in the radiology section, and that is ultrasound CPT. The codes are used to report the diagnostic as well as the interventional ultrasound procedure, and the code range is 76506 to 76999, and they are maintained in the AMA CPT edition. So if you see the ultrasound section, it includes the codes which are used to report the diagnostic medical ultrasound procedure as well as the interventional. This code covers the various body areas and the specialty, including the obstetric, abdominal, vascular, cardiac, and the soft tissue imaging. Each code reflects the factors such as anatomical site, exam type, whether it is a real time or Doppler, and then the clinical context, like whether you have done the ultrasound for the pregnancy or it is non-pregnancy condition, and if it is a pregnancy, the trimester number of the fetuses also plays important role. The proper coding ensure the accurate documentation and reimbursement. So if you see, this is the diagnostic ultrasound, which is divided into different heading like head and neck, chest, abdomen, and pelvic. The pelvic is further divided into the obstetrical and non-obstetrical, and then the genitalia and the extremities. Now, when we talk about the ultrasound, we use the word complete and limited. What is complete mean? Complete ultrasound involves the thorough evaluation of the target region. It must include all required elements as defined in the CPT code descriptor. For example, a complete abdominal ultrasound which is given by this code include liver, gallbladder, pancreas, kidney, spleen, and aorta. So complete is including lot of structure in that area. It is a region. It is not a particularly focusing one particular organ, because when we are focusing one particular organ, then it is a limited, because it focuses one or few specific structure or a targeted clinical concern. Limited usually we carry out whenever we are doing follow-up, whether it is a quick assessment or when the full survey isn't medically necessary. Like suppose if the lady is pregnant, I'm more interested only in her uterus rather than going for the complete abdominal ultrasound, because what is happening in her uterus, that is she's pregnant and I want to see the baby. So that becomes a limited. So that's the basic difference, and we have a two different code for that. And now, what are the guidelines? The document should contain all the listed element or should have a reason that an element could not be seen due to surgically absent or obscured by the bowel gas. If less than the required element for the complete exam is done, then it would be reported with a limited study code. So whenever we are not able to see elements in the complete, then we need to write the reason, either whether it's surgically absent or it is obscured by the bowel movement. And usually if it is less than the required element, then rather than writing the complete, we write a code for the limited. A limited exam of an anatomic region should not be reported along with the complete exam of the same region performed at the same session. Remember, if perform at a different session, it can be billed both services with modifier 59 to the limited service CPT code. Now let us take one more question. Due to an elevated CEA level, 2 years following a colon resection, the patient oncologist ordered the diagnostic liver ultrasound. Code this encounter, and we have the following code. So if you look at the code 76975, it is a gastrointestinal, but it is a endoscopic ultrasound. In our case, they haven't used the word endoscopic, so we cannot use the code. The 76705, it is a limited ultrasound, and 76700, it is a the complete ultrasound. Now we need to find out whether it is a limited or complete. Now here they have used the word diagnostic liver ultrasound, so it is very limited to that particular organ. So we can very well zero down our. So yes, 76705 is the answer, because it is talking about the limited uh, the liver ultrasound. Now, these are the various modes of ultrasound. This is just for your knowledge. Some of the codes, they do mention the real-time scan or A mode or M mode. So you must know these are the different ways we can take the ultrasound. And so here you can see the ultrasound abdominal real-time with image documentation and complete. So that means it is ultrasound of the abdomen. Complete means they are seeing a lot of different organs like liver, gallbladder, and stomach, and they have also mentioned the the mode. It's a real time here. Now, most of the ultrasound we have seen, they either talk the language complete, limited, and A time, and V scan and real time scan. But as far as the pelvis is concerned, we have the two different category, that is obstetrical and non-obstetrical. So the non-obstetrical pelvic ultrasound can apply to both the female and the male patient, but the code differ based on the anatomy and clinical indication. Non-obstetrical means whenever there is no pregnancy, and that can apply to both male and female. While the obstetrical, it is a perform in the pregnant patient to assess the developing fetus and the pregnancy. Now, first, let us look at the non-obstetrical pelvic exam. It also has the complete and limited. Now, the complete code is 76856 ultrasound pelvic. In the bracket, it is written non-obstetrical real time with image documentation, and is the word is complete. Now, remember this code is very important because this same code I can use it for the male or female pelvis. But if it is a female, it has to be non-obstetrical. And this is the code which is for the limited exam. So ultrasound pelvis non-obstetrical real time with image documentation limited, because this is a indented code. So these two codes are important, and remember this code I can use it for male or I can use it for female. Now, when the lady is pregnant, it is a obstetrical pelvic exam. Now, the CPT code describes the ultrasound examination during the pregnancy. They are based upon the trimester, type of the examination, number of the fetuses, ultrasound approach, and extent of the exam. And so we divide them into younger than 14 weeks and then more than 14 weeks. Younger than 14 weeks, we have two codes. So the first code is 76801. It is ultrasound of the pregnant uterus, first trimester, transabdominal single fetus. And this is the add-on code for the each additional fetus. So if it is a pregnant woman, I will write 76801 and 76802 because it is very clearly given. But this is the first trimester. Now let us look at the older than or equal to 14 weeks. Then we have the separate code. So these are the code when it is more than 14 weeks. Now in this case we have the various code. So if you see the code 76805, this is a complete obstetrical ultrasound single fetus, and then this is the additional fetus. This is the detailed obstetric ultrasound single fetus, and this is the detail for the additional fetus. Then this is a nuchal translucency scan first trimester. So this is the for the first trimester, and then we have a limited ultrasound also, and then we have a follow-up, and this is the transvaginal. So these are the code which we use it for the obstetrics. So always pay attention whether it is a complete and what is a trimester and for which fetus you are doing. Are you doing it for the twin or are you doing it for the single fetus? That plays important. So for better understanding of all the codes, let us look at the first question. The question is, the patient is 15 weeks pregnant with twins coming back to her obstetrician to have a transabdominal ultrasound performed to reassess the anatomical abnormalities of both the fetuses that were previously demonstrated in the last ultrasound. What code should be used for this procedure? Now, if you look at the code, the option C we need to eliminate because the patient is 15 weeks and we use that code, these two codes whenever the patient is less than 14 weeks. Now we have left with A, B and D. Now what has happened is, here the patient already had one ultrasound and she is coming back to her obstetrician to have transabdominal ultrasound performed to reassess the anatomical abnormalities. So if you look at the code, we might use the code 76815 or 76816. Now 805 and 810, it is a complete OB ultrasound and complete OB ultrasound. Whether we require those two codes or this codes, that will zero down our answer. So tell me, what is the answer? So yes, B is the correct answer, because the patient is coming back again to reassess the anatomical abnormalities. And if you look at the code 816, it is a follow-up, and look at the language of the code: ultrasound pregnant uterus, real time with image documentation, follow-up for re-evaluation of the fetal size by measuring the standard growth parameter and amniotic fluid volume, a re-evaluation of the organ system suspected or confirmed to be abnormal of the previous scan, and the lady had a previous scan and it is a transabdominal. And here there is a parenthetical note: report 76816 with a modifier 59 for each additional fetus examined in a multiple pregnancy. In our case it is a twin pregnancy, so we'll put modifier 50. Now, let us take one more question. The physician ordered an ultrasound on the patient 25 weeks pregnant with a twin to access the fetal heart rate and fetal position. Select the code, and we have this option. Now, let us look at the code. First of all, there is no mention that the patient has come back or this is a second ultrasound. So, I can very well eliminate 76816 because this is for the follow-up. And then we need to check in between the A, B and D. So kindly read all the code languages very carefully and zero down your code. So yes, 76815 is the answer. Now the question is, here there are twins. But if you read the language of the code, it says ultrasound pregnant uterus, real time with image documentation, limited, example fetal heart rate, placental location, fetal position and qualitative amniotic fluid. And below that it is written, use 76815 only once per exam and not per element. So though there are twins, we will use this code only once because we count the per exam, not per element. So this is very important, and that's why it is, I always say that it is best, if you want to clear this exam in first attempt, you need to practice a lot, because these are the small print that you will catch when you do a lot of practice. Now the next important topic is the image guidance. Now what is image guidance? It is nothing but a medical technology that uses the imaging to help the physician plan, perform and evaluate the surgical procedure and other therapeutic intervention. It can help make surgeries more precise, less invasive, which can lead to the shorter hospital stay. Means basically when I have an image, it will help me to direct my needle or direct my even the radiation, or even in the angiography also it will help me to do the stenting without completely doing the opening of the patient. So that's why it is a non-invasive method. Now the image guidance uses the imaging modalities. So if you have seen the guidance, it is broadly divided into the ultrasonic and then the radiation guidance. And in that you will see that under the radiological guidance we will have a fluoroscopic guidance, CT guidance and MRI guidance. So pay attention to that. Now let us look at the certain guidelines. So the image guidance is not separately reportable when it is included in the base service. Image guidance codes require image documentation in the patient's record along with the description of the imaging modalities used for guidance in the procedure report. And one must read the parenthetical notes carefully, because that will give you a clue whether you need to add the image guidance separately or no. So let us take example. Now, if you see this particular code here, it is the here it is written that fine needle aspiration biopsy including the CT guidance. Now, in this the guidance is already included, so there is no need to code it separately. Now, if you see the code, this particular code, this is for the ultrasound guidance, and you have written plus a sign. That means you will write whatever the procedure you have done, and for that procedure, if you have taken the ultrasonic guidance, then you will write that this as the second code. So remember, there is always you will see a plus sign. And now below this is the code for the ultrasound guidance. But remember, there is a parenthetical note and which says do not report 76937 in conjunction with all this code. So let us look at this code. This code is transcatheter insertion or replacement of the permanent leadless pacemaker, right ventricular, including the image guidance. So whichever kind of image guidance, but it is included in this, so there is no need to write the ultrasound guidance separately. So pay attention whether it is included or not, and if it is not included, we need to code it separately. So let us look at one example. A patient present to freestanding radiology center and had ultrasound guidance needle placement with imaging supervision and interpretation of two separate lesions in the left breast. The procedure required several passes to complete. How would you report the imaging? So 76932 is ultrasound guidance for the endomyocardial biopsy. 76941, it is ultrasound guidance for the intrauterine fetal transfusion. And 76942 is ultrasonic guidance for the needle placement, imaging supervision and interpretation. So I think 76942 is the right code. Now whether so A and B goes away, in between C and D, tell me the answer. So yes, 76942 is the correct, into 2 is the correct answer. Why into 2? Because there are two separate legions. And whenever there are two separate legions, we code it, we code it into 2 because we have done it, and LT stands for the left breast. Now let us take one more example. A 63-year-old patient with a bilateral ureteral obstruction present to an outpatient facility for the placement of the right and the left ureteral stent along with an interpretation of the retrograde pyelogram. What code should be reported? So there are two codes which we need to check. So first we are going to check whether 52332 is correct or 52005 is correct. So 52332, it is the code for the cystourethropy with insertion of indwelling ureteral stent, and 52005 cystourethropy with ureteral catheterization with or without irrigation installation or urethropylography exclusive of the radiological services. So the stent has been put up, so I will require a code 52332 because it's very clearly written insertion of the indwelling ureteral stent. So in between A, B, C, D, C and D goes away. In between A and B, tell me what's the answer. So yes, 52332 along with the modifier 50 is the correct code because this is talking about only one stent. We have put left and right, so we will require the modifier 50, and 74420 and 74400. In that we are looking for how this pyelogram has been taken. Is it taken retrograde? So if you check the code 420, it is a retrograde urography, and if I check this, it is a urography intravenous with or without KOB, with or without tomography. We are looking for the word retrograde. Retrograde is against the direction of the urine whenever you are carrying out the pyelogram. So the next question is, 42-year-old has a lesion on his pancreas. The physician passes the biopsy needle through the skin and remove the tissue to be sent to the pathology. Fluoroscopic guidance is used to obtain a biopsy code this encounter. So we need to find out what has been done. So 48100, it is the code for the biopsy of the pancreas open, fine needle aspiration, needle core or wedge biopsy. Then 48102 is biopsy pancreas percutaneous. What is our biopsy? It is very clearly given that through the skin, that is percutaneous. And 120 is the excision lesion of the pancreas, so we won't require that code. And 102 as we have already seen. So we will definitely require a cord biopsy of the pancreas percutaneous needle. And here there is a very important note that for the radiological supervision and interpretation, see this code 76942, 77002, 012 and 021. So all these different codes are talking about the different modalities we have used. And in our case, we have used the fluoroscopic guidance. So let us zero down our answer. So yes, B is the correct answer because that's for the fluoroscopic guidance. So let us look at what is mammogram means. It is nothing but an image of your breast. It can be used either for the breast cancer screening or for the diagnostic purpose. Now let us understand the basic difference between the screening mammogram and the diagnostic. Screening is used to detect the breast changes that could be cancerous in a woman without symptoms. The goal is to detect the cancer early so the treatment is less invasive. And the diagnostic mammogram, it is used to investigate suspicious breast changes such as lump, pain or nipple discharge. Used to evaluate abnormalities found on screening mammogram. So screening is basically general screen the person in order to detect the changes. Like whenever you go to any important event or the flight, they do your screening. What? Because they want to see whether you are carrying something. So similar is the screening mammogram. While the diagnostic is basically whenever the patient is having a pain in the right breast, the doctor will take the images of the right breast to find out the problem. So this mammography is done by the MRI imaging, then digital breast tomosynthesis or the X-ray imaging. So there are three modalities that we use in order to take the images of breast. So first look at the breast MRI. It is a medical imaging test that uses the magnetic field and the radio waves to create a detailed imaging of the breast. And in that we have four codes. One is without contrast and then without followed by with contrast. And all the codes are for the unilateral or bilateral. So 77046 is the unilateral without contrast and this is bilateral without contrast, and these two code are unilateral and bilateral without followed by with contrast. Now here it is the where we are taking the X-ray of the breast, and here the CAD, that is computer aided detection, is included in almost all the code. Now whenever we are talking about the X-ray mammography, it is of the two types, screening and the diagnostic. Remember, the screening is always bilateral while the diagnostic can be unilateral or bilateral. Now suppose when a screening mammogram is converted into the diagnostic mammogram on the same day, both the screening and the diagnostic code should be built with the modifier GG appended to the diagnostic code. It is very important because you are trying to check some, the lady has a yearly checkup. And in that the screening mammogram is included. So while doing that screening mammogram, the doctor found out that there is some abnormality. So he again take the diagnostic mammogram, and in that case you will build both and you are going to put the GG modifier on the diagnostic code. Remember, very important. And then the next is the breast tomosynthesis, which is a 3D mammography or digital breast tomosynthesis. It is an advanced form of breast imaging that uses a X-ray to create a three-dimensional image of the breast. So this is a digital tomosynthesis, and in that also we have a diagnostic and screening. Screening is in by default bilateral, while the diagnostic we have the option of unilateral and bilateral. So let us take first question. A 47-year-old female with a history of fibrocystic breast disease present to the mammography suite for the screening bilateral mammogram. The radiographic images are further proceeded using CAD detection with digitization of the image. What are the procedure code for the encounter? So what has happened is the screening bilateral mammogram, and I told you that screening is always bilateral. So let us look at the code and we tell me the answer. So you can go through all this code. It is pretty much simple that it is a bilateral and it is a screening. So there has to be one code because screening we always carry out bilateral. So yes, B is the correct answer because it talks about screening mammogram bilateral. So let us take one example. Irina, 45-year-old asymptomatic female, comes in for her annual bilateral screening mammography. Her physician ordered a CAT detection along with the mammography. The procedure was performed in a hospital. How would you report the professional service for this study? And we have all this code. Now, if you look at the code 77061 and 063, it is about the breast tomosynthesis, which is a 3D imaging. 67 is for the bilateral screening, bilateral mammography, and 666 and 61, it is the diagnostic. One is a diagnostic tomosynthesis. So go through all this and tell. So yes, how will we decide the code, whether it is a screening or diagnostic, and what is the mode of mammography? Is it a X-ray, tomosynthesis, or a MRI? And in our case, it is a the X-ray mammography, and that's why 77067 is the right answer, and it's a bilateral, so there is no need to put a modifier 50. Let us take the next question. A 56-year-old female is having the bilateral mammogram with a computer aided detection conducted as a screening since the patient has had a previous cyst in the right breast. What surgical radiological services are reported? So what she underwent a screening mammograph, and the so if you look at the code 77054, it is a ductogram and galactogram. That didn't happen, and then that's why one code is wrong, automatically that answer is wrong. And in between B, C, and D, this talks about the screening digital breast tomosynthesis. That didn't happen. So in between B and C, we need to decide the code. So tell me what is the answer. So yes, C is the correct answer. B can't be the answer because if you see the code 77067, it includes the word bilateral. Bilateral. So there is no need to put the modifier 50 separately. It is called as upcoding, that is, and that's why C is the correct answer. Now the next is a DEXA study. It is a scan done by the X-ray, which is also called as the DEXA scan, dual energy or absorptiometry scan. It is a painless procedure that measures the bone density and composition. It uses low dose X-ray to determine the amount of the calcium and other minerals in the bone. DEXA can also measures the muscles and the fat composition. Now, usually we use the DEXA scan to check the bone density, fracture risk, and fat and muscle composition. Now, as far as the guidelines are concerned, first of all, we need to find out the imaging modalities. Know whether the code refers to the fluoroscopy, DEXA, CT, or MRI. Then check the anatomical site. Differentiate axial and peripheral site. Axial include the spine and hip, and peripheral include the periphery or the extremities. Use the density codes appropriately. Select the correct DEXA or CT code based on the site and the purpose. Fluoroscopy codes are for the guidance. Use as a add-on code for the procedure like joint injection. Bone age and arthritis imaging have a specific code. Choose the correct code based on the clinical purpose. So these are the code for the bone and joint studies, and you can look here, it is a bone age study, here it is a bone length study, this is the osseous survey, then this is the complete survey, everywhere the axial and appendicular skeleton is included. When it is a complete, it is both, and when it is limited, it is particular area. So all these are the code for that, and pay attention to all the code languages, and then you can zero down the right. So let us take the question. Sally had a DEXA bone density study for her hips, pelvis and spine. The procedure was performed in the hospital. How would you report for the professional service of this study? So what has been done is DEXA bone density happened, and where did it happen? Hips, pelvis and the spine. So that is basically your axial. Axial means the bones which form the axis of the body. Axis is the thing which is at the center. Okay, so look at all the code and then tell me the answer. So this is a DEXA study, that is dual energy X-ray absorptiometry study, and the area is hips, pelvis and spine. Pretty easy and straightforward question. So yes, 77080 is the correct code because it is talking about the dual energy DEXA bone density study, one or more site, axial skeleton, hips, pelvis and spine. And so we will write that, and they have asked the professional service, so we will put the modifier 26. So let us look at the question. A CT density study is performed on a postmenopausal female to screen for osteoporosis. Today's visit is the bone density study, and it will be performed on the spine. Which CPT code should be used? And so we have the various code, and in this case what is the modality is a CT which they have used it, and they have done it for the for the osteoporosis, and today they are doing it for the spine. So and we have to code the today's visit. So let us look at the code. 77075 is a complete axial and appendicular study. It is the indented code. So kindly look at the code above that. 77080, it is a X-ray absorptiometry. 77078 is a CT tomography, bone mineral density, one or more site, axial skeleton, hips, pelvis and spine. And 72020, it is a radiological examination. In our case it is a CT density, and today it is for the area that is spine. So tell me now, after going through all the codes, you can zero down your answer. So yes, 77078 is the correct answer because it is the CT bone mineral density study, and the area is also given hip or pelvis or the spine, that is axial skeleton, and so C is the correct answer. This is my last slide, and there is one more part of the radiology which mainly talks about the radiation, that is the therapeutic radiology.